Hi, I'm Lori Ballard. I want to welcome you to my YouTube channel. Also, I want to talk to you today about my book, Keys to Success: How to Study for NCLEX and Feel Ready for Practice. I've been a registered nurse for almost 36 years now. 26 of those years were spent in very specialty areas at the bedside. I started in the OR, PACU, endo, same-day surgery. From there, I worked for a gastroenterologist for a while and helped him set up an outpatient endoscopy unit in his office. I've done some home health, case management at the administrative level, which had a huge influence on what I have to share with you and how I've learned so many different things about the nursing process and healthcare in general. After that, I went back to the traditional bedside in the nursing pool, worked in the ER, triage, supervised. From there, I wanted to get off 12-hour shifts, and so I started back at the same doctor's office that I'd worked for previously, did some office management there, and from that, I transitioned into student health at a university setting. From there, I finished my master's degree in 2011, so I have been teaching for almost 14 years now. For the last 10 years, I've been mentoring students, helping them get ready for NCLEX. I have learned so many things, much of which I share with you in my book, Keys to Success: How to Study for NCLEX and Feel Ready for Practice. So what makes me qualified and trustworthy? First of all, I was a struggling student. High school came very easy to me. I didn't have to do homework. I didn't have to study too much. And when I got to college, it wasn't that the material was difficult. It was the pace at which we took the material. On top of that, I'm a very slow reader. And so reading comprehension was an issue for me. As you can tell by the dates and the picture, it's been a minute since I was in college at the BSN level. There wasn't a lot of resources outside of just traditional lectures, what my professors could draw on a chalkboard. God, that makes me sound old, but it's true. So there wasn't all these go look something up, go Google it, pull up a YouTube video, go watch an animation. And so I really struggled as a student. It took me a little bit longer to process things. To be honest, I worked too many hours outside of school, I thought, because I wasn't doing a lot of extracurricular things, that I was focused on school, but I was still very distracted by a lot of other life events. So as I mentioned earlier, we didn't have a lot of predictors, other than an NCLEX book. You had to read through, do the practice questions, look the answer up in the back. There wasn't all these electronic predictor tools, huge practice banks and video content and predictor exams that simulated NCLEX. There was really none of that. And so I'm sure a lot of my professors were very unsure about my ability to perform well academically. Clinically, I did great. I didn't have any problem. It all made sense at the bedside. When it came to pencil and paper, again, I really struggled. And so I want to share with you the things that I have learned that finally made sense to me and that I wish had made sense sooner. The things that I talk about in this book are not only things that I've learned from students as we have worked together in the mentoring process, but it's also things that helped me transition from all those different specialties. And I was able to transition, I think, a lot quicker using this process. And it helped me make sure that I was taking care of patients safely, and it helped me get settled into my new specialty area much better and, much more successfully. So not just the bare minimum of keeping patients safe, but it helped me to transition and to also do a very good job. So my mission in writing this book, Keys to Success: How to Study for NCLEX and to Feel Ready for Practice. The methods in this book are very traditional in respect that it relies on nursing process, the foundations of nursing, nursing diagnosis, nursing care plans, and how to use those to connect the dots as you prepare for practice and get ready for NCLEX. So it's not a shortcut. It's not a workaround. It is a very efficient way to study, and it not only prepares you for NCLEX, but also better prepares you for bedside practice, because at the end of the day, the best nurse that you're going to be is very low tech. It's going to rely on nothing but your assessment skills, your recognition of subtle changes, your understanding of pathophysiology, and are you familiar with and can recognize, okay, what nursing diagnosis or care plan would this be? And what are the goals and what are the interventions for that patient? And so it's a way to make things make sense when you really don't know what you're doing yet, which you're going to have to be really patient with yourself because it's going to take a bit before you see enough patients that things begin to make sense and you begin to put everything together. We're teaching you things in nursing school right now that aren't going to make sense for 5, 10, 15 years. And so you've got to rely on those fundamental aspects of nursing, recognizing what care plan is this? What are the plans? What are the interventions? What are my goals? These standardized things, will they work for this patient? And what adaptations do I need to make so that I'm giving the best care possible to my patient? So it's a very fundamental way of doing things. The book will help you get organized. It's not a complete content review. You have all of those resources. The NCSBN website gives you the test plan. So this book is more a way to organize the resources that you already have and to use them efficiently in a prioritized way. So it really focuses on how to study and what to do, not what you should know. You're going to need to get those from those original sources. Overall, what will the result be? The result will be that you'll be conditioned to take the 85 question exam and not the 150 question exam. And more importantly, you're going to feel ready to practice. You're going to take better care of your patients, and your patients are going to feel safer knowing that you're their nurse for the day. So how can you get this book? You can go to my website, Keys to Success, lballard.com. You can go directly to Amazon, and if you are a Kindle Unlimited member, then the book is free. So really no reason not to take advantage of the ebook. If you are not a Kindle Unlimited member, the ebook is only $4.99 for the download. If you'd like a paperback version, which really I would recommend, what I had designed this book to be is more of a workbook, and you can see that the printed version is about the size of a regular sheet of paper. So I'm sorry I'm not left-handed, but you'll be able to tell that it's very bulleted, very much checklist oriented, so that you can go through the different things and check off, have you looked at this or have you reviewed this? Now, this is not a book that recommends that you undo things that work well for you. That is not what I want at all. These are just ways to make sure that you've done everything you need to do to be prepared and that you're confident when you go to sit down and take the exam. Paperback version on Amazon is only $12. So very reasonable. I wanted to make sure that I kept it short and brief, that it's easy to use, and that it's very inexpensive so that you aren't out one more penny, because I know how much money you've spent during nursing school and in the process of getting ready to take your NCLEX. The other thing that's available on my website is consults. I would love to help you on an individual basis, and so we can work together and kind of meet you where you are and customize a plan that will work well for you. I'm also on social media. I really am hoping to build my YouTube as my major platform. So social media will be more of the shorts, words of encouragement, a little more entertaining. Not that I always have the right answers, but I do try to stay positive, and I do try to give you just some quick tips and things to help you through the day, because nursing school is tough. But you can do it. You've done it thus far, and I'm sure your nursing school is lined with pictures of graduates that have been successful. So you can find me on Facebook, TikTok, Instagram. I have some other of the social media threads. I find a lot of nursing students there. Twitter, Lemonade, I have, but honestly, I just don't find them as user-friendly for nursing students, and I'm probably not the platforms that you are on most frequently. So YouTube will be my big go-to. You'll find videos for tutorials that I hope to build. This is my first time publishing, so all of this is very new to me. I appreciate your patience. So I want to just say thank you for taking the time to watch this video, letting me introduce myself. And if you'll follow me on YouTube, subscribe to the channel, I really want to help you feel better about getting to know me, understanding why I've done what I have, and helping you through that process. And again, it's not just about passing NCLEX. That is very important. You can't meet your other goals until you can reach that one. But I really want you to feel better about your practice and transition into that entry-level nurse feeling more confident that you can provide safe, quality care for your patients. Again, my book, Keys to Success, How to Prepare for NCLEX and Feel Ready for Practice. My name is Lori A. Ballard, and I appreciate your time. Have a great day.